In this video, we're going to address any pain that you may be experiencing in your knee. And if you have chronic knee pain from a past injury or you're having a symptom from a recent injury, please schedule an appointment with a physician as soon as possible and get a recommendation for physical therapy. This video is meant to help mitigate pain in the process of us getting evaluated. We're going to discuss things like how to loosen up some of the tight tissue in the surrounding area that could be leading to muscular imbalance and creating inefficient movement, how to promote blood flow and reduce inflammation in the area of the knee, and isometric exercises for strengthening connective tissue that's going to help you be more stable and efficient when you do your movements. For equipment, we're going to need a foam roller and a Voodoo Floss band. First, we want to start by promoting blood flow to the tissue surrounding the knee. Let's start by grabbing a foam roller and doing some myofascial release work on your quad and IT band. While laying face down in a kneeling plank position, place the foam roller right above the knee on your quad. Then, press through your forearms and roll yourself down, moving the foam roller up toward your hip. Perform this for 1 minute per side. If you're struggling to move yourself on the foam roller because it's too painful or you just don't have enough upper body strength, try performing with both legs on the foam roller. Search for sensitive and tender tissue while taking deep breaths, and once you find a painful spot, you can also go into knee flexion and extension to help promote blood flow and increase fluid dynamics to that specific area. Tight quads can pull on the patella tendon, the kneecap, causing misalignment and increased pressure. This generally correlates with having a weak hamstring in relation to your quads, which affects how your patella tracks during knee flexion. When we finish this, we want to do a little bit more self-massage therapy work, but now with our hands so we can be more specified in the area we're working. While sitting on the floor with your legs extended out in front of you, if you have tight hamstrings and this position is uncomfortable, sit with your back against a wall. Take both hands and feel around the surrounding area of your kneecap. Explore for any painful tissue and just give a light massage. After 30 seconds of this per side, take your kneecap and lightly shift it from side to side for 10 repetitions. Again, search for any pain or discomfort and just feel around in the area and learn more about your knee. We need our legs in front of us, but not fully extended, activating with our quads when our legs are locked out. If we do this, we will not be able to move the patella around as we're in this process. Next, we're going to perform some knee flexion and extension by doing some CARs, which are controlled articular rotations. From a seated position, maybe using the wall against our back to support ourselves again, place both hands behind one hamstring. Lift your leg into hip flexion, and then start going into ankle inversion, foot rotating inward. Then, while maintaining that, lock out your leg into knee extension. Change your foot position into eversion now, the opposite way with our ankle, and then flex your knee back to its original position. Perform 10 repetitions, taking your time to segment the movement and not rushing. The goal of CARs is to maintain or improve the active range of motion that we currently have and enhance joint health and increase proprioception, which is the awareness of position and movement. This can help us identify and address areas of restriction or discomfort by, again, taking our body through a large range of motion. Next, if we have a Voodoo Floss band handy, sit down with your knee lightly flexed in front of you. Pull the band tight and start wrapping from under your knee, working your way vertically up around yourself. Throughout the wrapping process, do not restrict the kneecap for movement. So stop about 1 inch below and then continue wrapping above your knee about 1 inch above. Once we fully wrap around our knee, we want to go through a few ranges of motion, working through the largest range we can without recreating any pain in the joint. I recommend performing forward lunges for a set of 10 with a short step, working through a lot of knee flexion. If you're someone with less strength, elevate your front foot on something like a chair and then just push your weight forward, trying to go into knee flexion. Follow this up by sitting in a deep squat while holding on to something for 20 seconds. Again, if this creates pain, work in a range that it does not. The primary function of Voodoo Floss band is to provide compression to the targeted area. By wrapping the band tightly around the knee, it creates a temporary restriction of blood flow to the joint and surrounding tissue. This compression helps reduce swelling and inflammation by promoting lymphatic drainage. When the band is removed, there's a rush of fresh blood to the area, which enhances nutrient delivery and it helps remove waste products, thereby aiding in the recovery. After performing this on both sides, we'll move to an isometric strengthening exercise to strengthen the connective tissue around our knee and give us more stability. While in a split squat position, lower yourself down as low as you can maintain without pain. Then continue to maintain that position for 30 seconds per side. This is going to help work smaller stabilizing muscles around the joint. That's also going to have no shear force or minimal shear force because there's no movement except for holding that stationary position throughout the process. Use support for your upper body with a couch or something nearby if you find this too challenging. Following any activity or a long day at work, remember you can ice your knee for a little bit of relief and to help with inflammation. Use an ice pack on each side for about 20 minutes at a time and then rest for a bit. You can use a frozen bag of vegetables or fruit if you don't have any ice. By following this protocol, while seeking a professional opinion and assistance for a longer-term solution, we can help reduce inflammation and just improve your general range of motion and the surrounding tissue around your knee to help you move better and hopefully have less pain. Please reach out if you have any questions at all so I can help point you out in the right direction when it comes to your knee health. and I look forward to seeing you, and I hope your knee pain gets better soon. Thanks for being here.